Welcome back to Morning Express. It is now 29 minutes after 8 Kenyan time, and it's time for us to look at your health. Well, this morning we'd like to look at homeopathy, and joining me to have that conversation is Dr. Narendra Singh Teti. Good morning.
Good morning,
and
Michael.
Good to have you.
Thank you.
Thank you. And we also have Dr. Mrs. Harman Teti. Welcome.
Morning.
All right, let's start with a very basic question. And by the way, before we go to the question, just to let you know at home, if you have any questions that you'd like to ask, we are opening up the phone lines, and you can ask directly to the doctors as we continue with the conversation. But let's start with the very basics. What is homeopathy? Let me start with you, Dr. Narendra.
Homeopathy is a system of medicine, alternative system. And it's widely known in so many countries. In fact, the substances used to prepare homeopathic medicines, they are almost the same as conventional medicine. Conventional medicine, what we call allopathic medicine. Mm-hmm. And in allopathic medicine, minerals, herbs, and other substances are used. Mm-hmm. Metals are used to prepare the medicines. Mm-hmm. The same way in homeopathic system, it's same substances but prepared differently. There are different pharmacies, mm-hmm. how they prepare medicines. Mm-hmm. And
when you talk about the preparation being different, what exactly do you mean? Is it the chemical composition? Is it just the process?
Yes, the process. And for example, let me give you about paracetamol. You know, and herbal medicine, mm-hmm. and homeopathy. Mm-hmm. What is the difference? Medicines prepared in conventional system is like if 500 mg paracetamol is not working, you are supposed to take 2 tablets of 500. Means it makes 1000 mg, mm-hmm. or 1 gram or whatever. It increases the medicinal substance, mm-hmm. to increase the medicinal power. The same way herbal medicine is like if 1 spoon is not working, you take 2 spoons of that herb. Mm-hmm. But on the other side, when it is homeopathic system, the more the substance is reduced, the amount, the quantity is reduced, more powerful it becomes. So it's completely different system of medicine, mm-hmm. and it is very much scientific. Mm-hmm. And
so are you saying that the more the quantity is reduced, the more powerful it is, meaning you take much less in terms of what you consume?
Yes. And the lesser the substance is, the lesser the side effects of that substance we get. Mm-hmm. Okay. In fact, there are no side effects as well. I mean,
on all the medicines?
On all the homeopathic medicines, mm-hmm. because the substance is reduced a lot.
Okay. Coming to you, Dr. Herman, what's the significant difference between now the herbal medicine and now homeopathic medicine, if it's just a process?
There is a main difference between the other system and the homeopathic is the homeopathic medicines are tested on human beings, mm-hmm. not like other system that those ones are tested on animals, rats and other things. So now they are tested on human beings, they have no side effects. And when the testing was done, the human beings, they tried to say that what they feel during that period, mm-hmm. when they were testing. That time their fears, their mind, any perversion of mind that time, mm-hmm. they were all noted that time. Mm-hmm. So because that, keeping in mind those things, so that's how we treat the patient.
Okay, so it's basically prepared after testing on human beings.
Yes.
But now I'm still not quite clear on the process, because if it's paracetamol, are you telling me there is homeopathic paracetamol and there is the conventional paracetamol?
Mm-hmm. Not necessarily, mm-hmm. Because in homeopathy there are purely one substance used. In most cases it's one substance.
For all ailments?
Yes. If it is sulfur, it is sulfur. It's very rare where we have got a combination, like maybe they mixed 2 substances. Mm-hmm. Otherwise, usually it is one substance. Mm-hmm. If it is zinc, we have to give, it is zinc. If it is club moss flower, a medicine is made lycopodium, it is lycopodium only. No, not really mixture of so many substances in homeopathy.
Okay.
But on conventional system and also on herbal system, if you buy those combinations, you will see so many medicines are mixed in one bottle.
To form
in
that
one tablet.
particular
Yeah.
concoction that one
Yeah.
would take. Now, based on your experience, what is the accuracy of effectiveness of homeopathic medicine?
Efficacy is, we can say that maybe 80 to 90% if it is administered correctly by the homeopathic doctor.
Okay. So one has to go to a homeopathic doctor to get a homeopathic prescription. Is that right?
Yes,
Okay.
that's how it is. Because self-prescription, I mean, it's really not that good.
It's not recommended.
And it's not recommended in any medical system. And it's quite known that when people, they don't have proper knowledge about any medicine, if they keep taking, they continue taking for longer period, like even homeopathic medicine, if somebody takes the medicines for very long period, it brings in those those effects of the medicine, what we call them side effects in conventional system. And when we talk about, they are tested on human beings, like what problems they create in a healthi person, the same problems any medicine will cure from that sick person.
Okay.
For example, if quinine is made from China bark, I mean from a plant, if somebody takes quinine, he will have the symptoms of malaria. And everybody knows that malaria is treated with quinine as well.
Right.
In conventional system. So it's just the similar thing. What a substance can create, a disease can be created with any substance, the same disease will be cured with the same substance.
All right. So homeopathic medicine is recognized by the World Health Organization.
Yes. In 2009, World Health Organization recognized homeopathy as a second best most used medicine all over the world. So almost over 500 million people all over the world uses this medicine. And it is very effective, not only in one or two diseases, almost many chronic or acute ailments are treated by this medicine.
Okay. How does one determine which medicine to go for, whether homeopathic or the conventional medicine? How does one, make that decision?
It's the patient who should decide, in fact.
Okay.
Because if, but like, in other countries, especially countries like India, and where homeopathy is at a very high level, very advanced, and it's, I mean, the Ministry of Health employs homeopathic doctors. If you go there, like if somebody is not feeling better with conventional medicine, they go to homeopathic medicine. And there are so many people, they have got their first choice to take homeopathy. They don't even try allopathic medicine, I mean conventional medicine. They prefer taking homeopathy because it has got less side effects and it works on the whole system from head to toes, even if somebody is suffering frequently from any problems. Again and again problems are recurring, so homeopathy can boost the immunity to cure the system. Okay. But it's a process.
It's a process. Now,
healing is a process.
When I listen to this and I listen to one who prescribes the conventional medicine, if I listen to a herbalist, everybody pushes their own kind of medicine and says it works best, no side effects, or even if they're there, they're controlled. How do you justify homeopathic medicine to be the best? On what's your gauge? How do you weigh that? How do you scale that?
The best gauge is human beings themselves.
Correct.
Okay? We don't have to push somebody. Just let me give you a small example of a lady having cramps, pains before periods. Okay? If a lady is having those pains since many years, and she's taking painkillers all the time, every month she has to buy those painkillers, and still she gets those pains every month, why she can't try homeopathy? And then she will tell you what has worked.
Are you saying then there is a solution for her in homeopathy?
Yeah.
That would it reduce the pain or will it stop the pain?
It will finish the problem. In fact, it works on internal organs, and you will see the patient will never he will just forget about those things that he used to suffer with those conditions because he is healed.
Okay,
Yeah.
That's just one example. What are some of the other things possibly that homeopathic medicine can answer that possibly conventional does not give a solution but gives a temporary reprieve?
The main problems are allergies, which cannot be treated by the other system of medicine. In homeopathy, we are very accurate to treat those type of allergies, either it is respiratory or digestive. Some people, they
Things
can't.
like asthma?
Like asthma, yeah. Very good medicines for asthma. Even in few months, people can stop inhalers, patient. Even they are very effective for children, adults, even old age. All the ages, this medicine is very good for them.
Okay, and this has been proved over time?
Over time, yes.
Okay, I want to come to something different, and we'll talk about how homeopathy helps, especially those who may be addicted to drugs. But before that, just to fully understand, are homeopathic doctors easily available? Are they readily available?
Some countries, they are there, but not many in Kenya.
Okay, so where does one find them?
They are there. Even you can find from Google search as well. There are some homeopathic doctors there, and we have talked on KTN severally, and people know as well that there are.
So they are there, but one, I guess, has to look for them. Do you operate under the Ministry of Health?
We are given permission by Ministry of Health. And it's not recognized at that level the way allopathic medicine is recognized, means the conventional medicine. But countries like India, if you see, there is a different ministry exactly. I mean, there is a separate director for homeopathy. It was separate director for conventional medicine and a different director for homeopathy. So it's not the conventional medicine director who is going to control the homeopathic doctors. So it's completely different.
It's a separate function.
Separate function.
Okay. And what's the origin of homeopathic medicine? Is its origin India?
Started from Germany, but since India government has taken it very seriously, and there are so many dispensaries and so many hospitals opened just for homeopathic medicines.
Okay. All right, let's go to some of the cures that homeopathic medicine offers, and specifically talking about drugs. I know that homeopathic medicine is big, or is said to be big, in terms of helping those possibly who are fighting addiction.
Homeopathy, we have been treating drug addicts like suffering from alcohol abuse, alcohol addiction, beers or wine or whatever you call it, spirits. And we have been treating with homeopathy, and they have improved a lot faster than they have been trying other systems.
Okay, so what's the magic behind homeopathic medicine in terms of dealing with addiction? Because addiction, as far as we know it, is something that first of all comes over time, and some of those who treat the addiction do it by somehow replacing and reducing over time. Is that the same system, or how does homeopathy help when it comes to addiction?
It is the same system. We also administer medicine only, but there is no need of counseling, and
we don't do counseling, in fact.
You also do counseling?
We don't.
You don't do counseling?
We don't do counseling. Because in most cases, people, when they are given counseling, people have tried rehabilitations twice, thrice, many times people are sent to rehabilitations, and relapses are there.
But with homeopathy, are you saying that relapses don't occur?
It is very rare, in fact. In our conventional system, I mean, if you ask those people who come to us, and there are almost about 90% relapse chances. But once somebody is treated with the homeopathy, it's very rare.
Okay, so I'll come to what it exactly does, but just for those of us who are watching, in case you have any questions, the phone lines are now open. They're displayed on your screen. In case you have any questions, maybe you have tried homeopathic medicine as an alternative and you have a testimony you'd like to share. Maybe you've tried and you'd like to just let us know how it is, or it is something that you'd like to try. Give us, let your questions come through. How does it work that it has no relapse according to what you're saying? What is it? Does it replace the desire? What exactly happens?
No, we can't say that there will be no relapse, but as compared to other system, they will be less.
Okay.
And in homeopathy, we don't give sedatives or tranquilizers. That is the main thing. And then we take the symptoms before drugs, before taking alcohol, or during when he takes alcohol, what type of behavior he does. Okay. And after taking alcohol, what type of behavior he produces. Like some people, they get so angry, they get so violent that they can break things, they can beat other people. Even some, they engage in criminal activities also. Even other person, they may be quiet or they just go to sleep.
So based on their what happens?
Behavior.
You're able to come up with an assessment of what they need.
Yes.
So Dr. Hari, help me understand, what is it that you're treating? Is it the actual addiction, or possibly what is causing the addiction?
Okay, every person number one, drug addiction. It's called brain disease. It is a disease, really. And there are some things behind it. I mean, genetic problems as well. How the craving for a certain substance. There are people, they like taking only wines, and there is different medicines which can work on wine. There are different medicines which can work on beers. There are different medicines in homeopathy which can work on cannabis, marijuana. So there are different medicines. And the way I said, okay, there are medicines for anger, there are medicines for telling lies, there are medicines for stealing in homeopathy. You know,
for telling lies?
Yes.
Medicine that makes you stop telling lies, or detects lies?
Of course, telling lies.
There
is always a reason why somebody is telling lies. Is it a fear? We treat that fear.
Okay.
Okay.
So is it a tablet that you swallow and somebody stops telling lies? Because I'm sure now the religious sector would come in and say lies are really an issue of the heart, not so much a bodily function.
You know, when you talk about religion and science, it's always
there's a clash.
There is a clash, okay. And we have seen many times things are failing when we go far from science as well.
Yeah.
Okay. So are you telling me that there is actually a medicine that one can take and they stop telling lies?
They stop telling lies.
Person never comes to us that can give me medicine for telling lies. He comes with some problem. So whenever he has this type of feelings, there is some physical problems also.
There's something in the background.
Yes.
Do we have a medicine for corruption? Given now that in the country, you know that's...
Okay, let me tell you one thing, Michael. Corruption or these type of things, when we are talking, somebody stealing all the time, or somebody becomes very rude, doesn't care, and somebody abusive, we have seen on media. And I can assure you, Michael, you treat that person who is abusing each other, even in public rallies. You treat their diabetes, you treat their blood pressure, you treat their physical problems. he will talk
So even the
differently.
hate speech we have is something you can treat with medicine.
It's not a normal behavior. It's a medical condition.
It's a medical the hate speech that we see is medical.
Very serious medical condition.
All right, let me take a call from Anthony Wanjala. Good morning, Anthony, and go right ahead with your question or comment. Anthony,
Yeah.
go ahead.
Good morning to you.
Yes, good morning, Anthony.
Yes, I'm very interested with what you are discussing on TV.
Okay.
The doctor have said that they have medicine almost of all kinds.
Mm-hmm.
My problem is I've been coughing. It's like I have allergy,
Mm-hmm.
and they say I have asthma for several years. I really, most of the time at night, I cough. When I turn on one side of my side, I cough. Then I'm forced to lay just on one side.
Okay.
And then I have itching ears, itching in my throat, and it itches in my nose. I have always, like now, this week, I have mucus coming out of my nose.
Okay, so
my mouth.
because of time, are you on any medication?
I normally just buy Seletamine.
Okay. All right. Well, we'll pose that to the doctors. Anthony, let me take another call from Evans Makori. Good morning, Evans, and straight to your question or comment.
Hello.
Yes, good morning.
Yes, my name is Evans Makori.
Yes, Evans.
I wanted to ask where we can get this medicine and at what cost.
Okay.
My issue is about respiratory issues whereby sometimes when there's a lot of cold, my nose gets blocked.
Okay.
Yes.
All right. Thank you very much, Evans. And let's start with Anthony Wanjala, who, first of all, has given some presentation of difficulties. It sounds like it could be asthmatic, but he's on certain medicine. Maybe what solutions would you have for Anthony?
We have medicines for him, but it depends. We'll select the medicine according to his behavior and what type of symptoms he has.
When you say behavior, do you mean symptoms? Do you mean
Everything,
how it presents?
everything. Like coughing, every person comes with different symptoms of coughing even. Some person, they get cough while dusting something, or sometimes with smell, strong smells, or even sometimes person while talking he gets cough.
Okay. Dr. Narendra, Evans would also want to know where to get the medicine and availability.
Okay, like Anthony and Makori, both of them, their problems are almost related to, nasal problem, respiratory problem. It can be asthma or nose blockage. There are very good medicines which can work on asthma, and I'm sure he will not need those inhalers carrying with him all the time. And somebody whose nose blocked, there are different times of blockage of nose. We have different medicines. There are people, their nose blocks in the morning only, and other people, their nose blocks at night only. So medicines are different as well.
Okay.
So we have to select medicine after seeing them. And he was asking about how much it will cost.
Yes,
it's not like the cost thing. We have to see the patient, and the consultation we charge is 1,000 shilling.
Okay.
And that is
all right.
normal.
Let me take a call from Agnes Musioka in Narok. Agnes? Good morning, Agnes.
How are you? Good morning.
Yes, go ahead.
My question is, I have a mother who is aged about 90 years. She suffers from rheumatoid arthritis and hypertension. She has been on treatment, nifedapine, brufen, and all those pain relievers for so long that it even caused her to have ulcers.
Okay.
Now, how can these doctors help? And how can we get them?
Okay.
And second question is,
Uh-huh.
there is a daughter who has allergic rhinitis, and she takes salbutamol when the attack comes.
You said she has a allergic? Allergic. Okay.
Allergic rhinitis.
Uh-huh.
And she takes salbutamol, at times prednisone.
Okay, but they don't seem to be working, right?
Nothing comes on and off. It depends on the weather.
Okay.
When there are these extremes,
right.
it becomes worse. Very
Okay.
cold, it becomes worse. When it's very hot, the body itches.
All right.
And there's a lot of itching of the ears, the eyes, and causes chest congestion, especially at night
right.
when it is
All
dark.
right. Agnes, I'll have to cut you short because of time so that we can get the answer to you. Let's start with her first question. She has a 90-year-old mom who has arthritis, hypertension. She's on celestamine, amongst others. What are solutions that you would offer?
There are medicines for arthritis in homeopathy, and we have to see the mama, even if she is too old, and we have to see her, and we have to know the whole history, and then we can select the medicine, and it works. Age does not matter. Okay, the process is slower when somebody is healing process. It becomes a bit slower when somebody is older, but that does not mean they should suffer.
Okay.
The solution is there. They can take medicines, and right now we were talking about asthma and those allergies and rhinitis, and still it can be treated and it can be cured.
Okay, with homeopathic medicine.
Yes.
Last question, and very briefly, doctor, is the system of treating disease or condition by using a very small amount of the substance that causes the disease or condition?
Okay, it's sort of a condition and disease as well. I mean, every medicine, not only the medicine, people, the way people think, somebody who lives in fear, who lives in anxiety, their internal organs as well are affected because of anxiety and fear. So they function abnormally, they can't function normally, those internal organs. And it's physical and mental, they go together.
Okay.
Yeah.
All right, because of time, we'll
Look
have
like
to
this.
wind it up right there. And yeah, I can see you came with a sample of some of the medicines. They look very tiny. Are these the medicines that you take, the one
Yeah.
takes?
Yes.
And,
Yeah.
and one would be enough for...
No, about 10 pills
pills.
somebody
10 pills.
takes. They
Okay,
are like mustard size,
Yeah,
very
they're very
small.
tiny.
Very
I'm sure
tiny.
you probably cannot see this at home, but they're very tiny. And are these now for any condition, or are there different ones for different conditions?
This is just a sample to
It's
show
just a
you.
sample. All right, thank you very much. I appreciate you coming to talk to us. That's Dr. Narendra Singh Tethi and Dr. Mrs. Haman Tethi, and we're talking about homeopathy. Thank you very much and for giving us that information. Well, that's where we'll have to wind up the show this morning.